Hi, good evening everyone. This is Thuc and now I'm making a video to talk about the latest new coronavirus news in Vietnam and Southeast Asia of July 30th. The first news I would like to share with you is that Vietnam records 9 new COVID-19 community cases. 9 new locally transmitted cases of COVID-19 have been detected, 8 in Da Nang and 1 in Hanoi. The latest information was released early July 30 morning by the National Steering Committee for COVID-19 Prevention and Control. The national total number of cases now stands at 459 and includes in the latest batch of new patients is the 76-year-old man who lives in Hanoi. Before testing positive, he has spent 3 weeks in Da Nang, where he went for a health checkup at the Da Nang Hospital, complaining of fast heartbeat. Among the 8 other new cases in Da Nang, one is a 36-year-old woman who works as a nurse in Da Nang Hospital. Meanwhile, Chairman of the Hanoi People Committee VanThuc Duong has ordered the ban on all crowds gathering, festival and the closure of bars and nightclubs, taking effect from midnight July 29. Earlier, Vietnam confirmed 4 new COVID-19 transmissions in the community on July 29 evening. The 447th patient is a 23-year-old man from Nam Tu Ním District, Hanoi. He traveled to the central city of Da Nang, where new cases of coronavirus community transmission were reported over the past few days. From July 12 to 15, he is being treated at the National Hospital for Tropical Diseases. The number 448 patient is a 21-year-old woman from area Thieu Kamun, Cu Kiun district in the Central Highlands province of Đắk Lắk. She practiced at Da Nang Hospital from June 20 to July 17. She is being treated at the Central Highlands General Hospital. The 449th patient is the 57-year-old US man residing in Hoa Khánh Bắc Ward, Liên Chiểu District, Da Nang. He was treated at the Da Nang Hospital on July 6 to 20, then transferred to Chợ Giấy Hospital in southern Ho Chi Minh City on July 20, and City International Hospital in Ho Chi Minh City on July 21st to 27. The number 450 patient is 46-year-old woman who took care of the number 449 patient. According to the committee, 276 out of the total COVID-19 cases were reported and quarantined upon arrival. The second news I'm gonna share with you is about the Asian notice on movement history of 8 new COVID-19 patients. Da Nang COVID-19 Prevention and Control Steering Committee has issued an urgent notice on the movement history of 8 new cases of COVID-19. According to the notice, the cases are either patients under treatment or taking care of family members being treated at 3 hospitals in Da Nang City, including Da Nang General Hospital, Da Nang Hospital, and Da Nang Transport Hospital. The first patient is a 63-year-old woman, only traveled to Da Nang General Hospital to take care of her husband from May 11 to July 27, and returned home to Điện Biên Phủ district in Thanh Khê district. She tested positive for SARS-CoV-2 on July 27. The second patient is a 40-year-old woman, stayed at Da Nang General Hospital between July 14 and 20 and July 23 and 26. She went to Tâm Phúc Restaurant, 142 Restaurant, Quảng Tín Loan Noodle Restaurant in Quảng Trung Road Vinmark Supermarket on the same street and visited a laundry service on Hải Phòng Road. She traveled to her hometown in Đại Hồng Commune in Quảng Nam Province between July 21st and 23. The third patient is a 42-year-old woman traveled from her hometown in VanThuc Commune in Quảng Ngãi Province to Da Nang General Hospital on July 24. The patient did not travel around until she tested positive for the virus on July 27. The fourth patient, a 55-year-old woman, stayed at Da Nang General Hospital from the morning to the evening to take care of her son. She returned home to her Hải Commune at 5 p.m. in the evening and went back to the hospital to sleep from July 15 and July 27. The fifth patient is a 43-year-old woman stayed at Da Nang General Hospital to take care of her husband from July 7 to July 27. The patient traveled back to her hometown in Điện Trung Commune in Quảng Nam Province using her son-in-law's motorbike. Her daughter took her turn taking care of her husband on July 24th. The sixth patient is a 19-year-old man, went to Da Nang General Hospital to visit a family member on July 21st. He then went back to Mining Book Coffee on Hà Tĩnh Road, visited his friends on Tôn Đức Thắng Road, transported a friend from the Da Nang University of Technology on Ngô Sĩ Niên Road to Phạm Như Sương Road, and visited supermarket in Hùng Vương Road between July 22nd and 26th. The seventh patient is a 61-year-old woman, had an eye test at the Da Nang Hospital on July 17 and was scheduled to have eye surgeries on July 24th. The patient went to busy supermarkets on Hùng Vương Road, attended a housewarming ceremony on Phạm Tuấn Tài Road, and went to Mới Market in Nam Dương World every 2 days. The eighth patient, a 39-year-old woman, took care of her mother at the Da Nang Hospital and worked at Cani M Da Nang Company in Hòa Khánh Industrial Zone between July 2016 and 23. She traveled to her hometown in Bình Định Commune in Quảng Nam Province and to Hội An An Sơn Town between July 23rd and 25th. The patient went to Da Nang Transport Hospital, where she was confirmed to be infected with the virus on July 28. And the committees has worked with relevant units to clarify those in close contact with the patients for testing and sterilized the places. People who was present at the location places at the given times are required to contact the committees for health monitoring instructions. The number 3 news I'm gonna share for you is that Health Ministry sends additional personnel to Da Nang coronavirus hotspot. This picture, as you see, these are transferring severe cases to the centrally run Huế Hospital in Huế City. The Ministry of Health on July 30 decided to dispatch more specialists to coronavirus hit Da Nang to help the central city efficiently deal with the virus outbreak. They include specialists from the Department of Preventive Medicine, the Environment Management Department, the Vietnam Administration of HIV/AIDS Control, alongside the Nha Trang Pasteur Institute and Ho Chi Minh City Pasteur Institute. They will work closely together with the 3 special working teams the Ministries of Health dispatched on July 25th. The ministries also decided to mobilize hundreds of students from Da Nang University of Medical Technologies and Huế University of Medical and Pharmacy to get involved in the fight against COVID-19 in Da Nang. The ministries have provided 10 ventilators and N95 respirators for hospitals in Da Nang and Huế. The centrally run Huế Hospital in Huế City has received 11 COVID-19 patients transfers from Da Nang under the Prime Minister instructions. One of the patients is in critical condition and is on the ventilators. And below here, the Health Ministry's issued emergency notice on 28th to COVID-19 hotspots. As you see the picture, that's the medical worker on duty at the lockdown area to disinfect people delivering supplies in Da Nang City. A list of venues identified as possible COVID-19 hotspots nationwide has been released by the Ministries of Health. Officials are asking anyone who has visited the location during a specific time period to contact the authorities for assistance. In the past week, there have been 42 new community transmissions, many in Da Nang, but also cases in Quảng Nam, Hanoi, and Ho Chi Minh City. The ministry has required those who visited the following areas during the mentioned time frames to immediately contact local centers for disease control and prevention for guidance on health monitoring. So that's the end for the article of today. Thank you very much for listening and hope to see you in tomorrow news. And I would like to thank he gave a big time to Vietnamnet.vn. I took all of the news from Vietnamnet. And if you want to know more about the update news about COVID-19 in Vietnam, you can go to Vietnamnet.vn to know more about it. Thank you very much and bye.